Hello. Recently, I have opportunity to assess candidates for one very simple case, and I want to share with you guys. We had one child who was 6 years old with some short stature. Majority of these candidates, they missed the diagnosis. So I will describe to you what the case was. So this was a male child, and on gait he was having waddling gait with severe lordosis, and on general physical examination he was having a typical trident sign, short chubby hands, prominent wrist joint and elbow joint. The movements were a bit restricted, and the head size was normal, and face was normal. There was no mid-facial hypoplasia, and then he was having rhizomelia and some scoliosis. In the lower limbs, he was having again short thigh with prominent ankle joints with the bowing of legs. So most of the candidates, they said this is some sort of skeletal dysplasia. So just to make how to approach with these children with a short stature is like this case. So we have, in this case, we have rhizomelia, and all of you know, if this acromelia, then the diagnosis is Turner syndrome, and if this mesomelia, then it's Ellis-Van syndrome. You have to examine the heart. But if you have rhizomelia, we have three common differential diagnoses. So please note it down. So any child with the rhizomelia with large head and mid-facial hypoplasia, our diagnosis will be achondroplasia. So what you have to do, you have to examine ears for grommet, you have to examine for skeletal for scoliosis, you have to examine chest for pulmonary hypertension, and fourth, very important, remember, you have to examine for atlantoaxial dislocation, which is very common in achondroplasia. So this is one first your differential diagnosis. Your second differential diagnosis is hypochondroplasia. So in hypochondroplasia, you have rhizomelia, but with normal head size with normal facies. So the hypochondroplasia is only isolated rhizomelia. Now your third differential diagnosis, like in this case, we had rhizomelia with normal head, normal face, but typical rhizotic changes. So wide wrist, bowing of legs, and wide ankle. So this child was having pseudoachondroplasia. So what are the features of pseudoachondroplasia is rhizomelia with typical signs of rickets with restricted elbow joint movements. This is very, very typical of pseudoachondroplasia. So this is our three differential diagnoses, guys. One very important thing you have to remember is always, in these cases, you have to do four tests. We call them the four tests you have to do. One is look for the overshoot test, and ask the child to stand and ask the child to put the arms on the side, and ask the child to bend forward, and you have to ask the child to sit and stand. And then you will confirm your differential diagnosis. So the next question will be, examiner will ask you how you will examine. So in this case, you can say I'll do skeletal survey, you can say I'll do bone profile, and you will do genetic test. And the next, you know, we have only 7 minutes. The next last question will be how you will manage this child. So the management is MDT, and I'll refer to genetist, orthopedic surgeon, and just MDT. So thank you.